Migraine and tension headaches is what I will talk about in this video. And let's start with migraine. Migraines are quite common in the population. Up to 20% of people can experience them. And I want to first talk about some of the triggers. There's a long list of triggers, but some of the more common ones include wine, certain stimuli such as lights or odors, strong odors in particular. Sleep deprivation, not getting enough sleep is a trigger. Stress in your life, and certain hormonal factors as well. That's why during menstruation women can experience migraines. Now let's talk about the symptomatology. The symptomatology of migraines is actually broken up into three phases. First is the prodrome, next is something known as the aura, and then finally the third phase is of course the headache itself. The prodrome essentially is a sensation that the migraine is actually about to begin. And it can be a wide variety of changes in the normal functioning, such as mood changes, loss of appetite. Also, sometimes the person can have nausea, and that's the first phase. The next phase is very important and really specific entirely to migraines, and that is something called an aura. Aura, the way I'd think about it, is sort of these visual symptoms that people tend to get. They include flashes, lights, bright spots or bright dots that they see. And this aura is very specific only to migraines. And then the actual headache. The characteristics of the actual headache are that it's often unilateral, one-sided, and its distribution in terms of where it occurs is the frontotemporal area. So keep that in mind. It's often described as pulsating or throbbing. And then there's a few very important things I wanted to mention that separates it from other types of headaches. The patient may also experience photophobia, which is essentially a fear of light. So they want to be in a dark room when it happens. They may also experience sonophobia, which is fear of loud sounds. And they also may experience osmophobia during a migraine episode. And osmophobia refers to fear of strong odors. So the person will want to be in a dark room, a quiet room, and will definitely not want to be around any of those odors that triggered the migraine. In terms of diagnosis, there's really no test. It's really just based on symptomatology, unless you are suspicious of something that may be very serious, something that is not a migraine. So for example, if you suspect a tumor or some sort of intracranial bleed, then of course you will proceed to maybe doing a CT of the head. But if it's just a migraine, then there's no reason to do any tests. Now you might say, why would I be suspicious? Very quickly, I just want to mention a few things. If the person starts vomiting, if the person has any loss of vision, if the person describes a headache that's really, really bad, especially in the morning, all these are signs of increased intracranial pressure, which can happen because of a tumor or even a bleed. So those are some of the things to keep in mind. Treatment of migraines. First thing, of course, is eliminate the cause, eliminate the trigger, identify the trigger, and make sure the patient doesn't get exposed to it. In mild cases of migraines, NSAIDs, non-steroidal anti-inflammatory drugs are enough. But in severe cases, there's two drugs that are commonly used. The first one is ergotamine, and the next one are the triptan drugs. And one example of a triptan drug is sumatriptan. Very, very popular headache medicine. So that's basically migraines. Well, before I get to the clinical vignettes, I have to talk about tension headaches. Now, tension headaches are fortunately a little bit more, I guess, don't involve as much. They really don't have any kind of prodrome or aura. They just go straight to the headache. So the headache of tension headaches, it kind of like, think about it as somebody tied a band around your head and was squeezing it. And that's really how it feels. It's like a vise-like or band-like quality. And the patient will also describe it as a tightness or describe it as a squeezing type of feeling. The location is also important, helps to differentiate from other types of headaches. It originates in the occipital area or the frontal region. And this headache is most commonly bilateral, and it spreads over the entire head. And unlike migraines, there's no nausea or vomiting, and there's no association with any light or sound or smells. In terms of diagnosis, again, really just clinical. There's no need to do any tests unless you suspect there's a tumor or something. Then you would progress further with maybe a CT. And in terms of treatment, they definitely, these types of headaches respond great to NSAIDs such as indomethacin and over-the-counter NSAIDs such as acetaminophen and even ibuprofen. There's usually a pretty good response. So now let's take a look at a few vignettes. 35-year-old woman complains of headaches that are throbbing in the frontal or occipital area. These have been occurring for most of her adult life, but have become more severe over the past several days, lasting the whole day, several times per week. They require her to take over-the-counter ibuprofen once or twice weekly, and usually respond thereto. Although the headaches remit during sleep, they recur during the day. Neurologic history and exam are all negative. Fundoscopy is negative, and blood pressure is 116, which is the following is most likely as a diagnosis. Well, the fact that they respond really well to ibuprofen was just basic over-the-counter NSAID, and specifically the region, the occipital and the frontal location, all point to this being a tension headache. Next question. 35-year-old man who works as an investment consultant in a brokerage firm comes to the physician because of daily headaches over the past 2 weeks. He reports that the headaches begin in the morning and last the whole day. The pain feels like a squeezing tightness around his head and particularly intense in the back. He does not drink alcohol or smoke, but he does drink many cups of coffee during the day. He admits that recently he has been under tremendous stress because of the volatility of the stock market and problems with his clients. Physical exam is normal. Which of the following is most appropriate next step? Well, this squeezing and the tightening around his head really sounds like a band-like or vise-like symptomatology, which is characteristic of tension headaches. And tension headaches respond great to NSAIDs, so choice A. And finally, a 29-year-old graduate student comes to the emergency room after leaving the library because of a pounding headache. She has allergies to mold and pollen and has had her usual symptoms of sinus congestion, runny nose, and sneezing over the past few months. She was at the library all morning studying when she began seeing little bright dots of light every time she looked up from her books. Sometime later, she developed a severe throbbing headache on the right side of her head and behind her right eye. She reports that the lights in the library began to bother her, so she closed her eyes and put her head on the table. She decided to come to the emergency department with the headache persisted despite taking aspirin. Past medical history includes allergies and history of migraines. Vital signs are essentially normal. Most appropriate immediate action is, well, the question pretty much tells you that she has migraines, but she definitely has this aura, seeing these bright dots of light. And then she also describes this photophobia. The lights are bothering her. That's classic for migraines. And the treatment of migraines really, it seems like it's pretty severe because she decided to come to the emergency department. So for severe, you can use either ergotamine or any of the triptans like sumatriptan. And of the answer choices, the one listed is B.